Hey, Patrick Hall, board certified podiatrist at the Bone and Joint Clinic of Baton Rouge. And today we're going to talk about how to stay out of my office in a world where we're all dealing with COVID-19, okay? Right now, the Louisiana Department of Health has recommended that we restrict office visits only to those conditions that will be worse if they're not seen within 30 days. So I'm going to go through today some of the frequently asked questions and conditions and try to give you some tips on how you can treat those at home and stay out of my office. The first one is plantar fasciitis. This is where you have first step pain when getting out of bed in the morning. It eases some with activity and general worsens as the day progresses. I see this 5 to 10 times a day, every day of my life in the office. Here are some of the things that you can do before coming in the office in order to try to get well. Number one is for the first step pain. I've got a prop here. I've got a night splint. You can get these over the counter at some of the drugstores. You can get them online depending on what's still shipping. The idea behind a night splint is it holds your foot at 90 degrees and helps stretch out your contracted plantar fascia so it isn't so painful with that first step and helps decrease some of the inflammation process throughout the day. The other thing that can help a lot is firm over-the-counter arch support, okay? The two inserts that I recommend the most on a daily basis, one is called a Power Step. It comes in blue and orange, and it's firmer than most of the other over-the-counter arch supports. That firmness fills the arch and helps take pressure off the plantar fascia. Now, for some people, the Power Step has too high of an arch, and so if you feel like it creates too much fullness, another one that's real good is SuperBeat, which is also pretty readily available in town. It's also firm, but it has a little bit lower arch height. And so for some people, they don't like so much arch contact with that. Calf and hamstring stretches can help. Ice anti-inflammatories can help. So if you're suffering from plantar fasciitis, now is not the time to come to the doctor's office for this. Shelter in place, as our state guidelines are recommending and changing daily, and try some of these simple things. Firm arch support, night splint, calf and hamstring stretches, ice anti-inflammatories. Okay, the second condition we're going to talk about is ball of the foot pain. Last year on my personal website, Dr. Patrick Hall DPM, this was the #1 landed on page, ball of the foot pain, and there's three major things. One is a neuroma, which is a pinched nerve between the second and third or third and fourth toes. Number two is a tendonitis called flexor tendonitis or capsulitis that you can get along the ball of the foot. And number three is a stress fracture, which is pain on the top. Really for neuroma and for flexor tendonitis or capsulitis, which is inflammation either of a pinched nerve between the toes or along the ball of the foot, the #1 treatment is something called a metatarsal pad, which is a little teardrop shaped pad that you could stick either in a shoe or on an insert, and it helps actually cheat pressure back in front of the painful area. If the pad is too far toward the toes, sometimes it jams it up and locks it. You can get these online, you can get these at drugstores, certainly running specialty stores like here in Baton Rouge, Varsity Sports and the New Balance store carry things like that. For a stress fracture, if you can find a friend with a walking boot, if you feel like you have isolated swelling along the top of the foot, you're grimacing and retracting with pain, compressing on the top of the foot, if you're walking with a limp, the stiffer the shoe, the better. Ice elevate, limit activity, and if you have somebody that you know that is a walking boot where you don't have to come into the office right now, that can be real helpful for that. So metatarsal pads, stiff-soled shoes, walking boot, these can all help ball of the foot pain. The third condition we're going to talk about on how to keep you out of my office during COVID-19 is diabetic foot problems. If you have a red hot swollen foot, if you have drainage, if you're afraid to go to an urgent care or emergency room because the virus is there, call our medical staff and we'll help you determine if this is something that needs to come in. In some instances with established patients, we might be able to call you something in. In some instances, we may need to have you come in to make sure you're safe. Things to look for are strict glucose control. The better your blood sugar is, the better people heal. Number two is have someone you know and trust look in between your toes and along the ball of your foot to see if there's an open wound, something draining, something of that nature. If you start running a fever, you may unfortunately have to go to the emergency room to have that evaluated. But you can certainly give our medical staff a call and we'll help you to determine whether that's something that needs to be seen or if it's something that can wait for 30 days. Number four, I'm going to talk about what conditions you should call for. Certainly infections, an acute injury that you think might be a fracture where you can't put weight on it. These are things that can be easily treated with a cast or a boot, things that have to be seen, you believe, within 30 days. This is a time where you probably don't want to go to the emergency room with stuff like that, because that's where the virus we certainly know is, because people are having to go for treatment. Post-op patients, if you're concerned about your bandage, if you're in a cast that needs to be changed, if you have stitches that need to come out, certainly those are things that to me would be appropriate right now. And the final thing we're going to talk about is when not to come in. Okay, if you have mild big toe arthritis, if you have Achilles tendonitis, if you have something where you'd like a cortisone shot because something's flared up, call us. And what we're doing with established patients right now who have some of those things arise, we're calling in steroid packs, we're calling in anti-inflammatories. We're trying to help you get through this temporary period until the Louisiana Department of Health restrictions have been lifted. The final thing is, one thing that we're doing at the Bone and Joint Clinic to try to keep our people safe as well as our patients safe is we're limiting hours now. Now this could change as this ever-evolving situation persists, but as of the filming of this, we're doing mornings only, we're doing weekdays only. We've closed our weekend clinic and we've closed our satellite offices in Prairieville and Livingston. This is so that we can do the appropriate screening for who can safely come and go in the building, both to try to protect patients, but also to protect our employees as well. So this is Dr. Patrick Hall at the Bone and Joint Clinic of Baton Rouge. I hope this helps. And unfortunately, it's such a scary time right now. I hope this helps keep you out of my office until this passes. Thanks so much, and please be safe.